Hello, everybody. My name is Cody Denler, and I am the Academic Fieldwork Coordinator and Instructor for the OTA program at the University of Charleston here in Charleston, West Virginia.
My name is Tracy Turley. I am the Site Coordinator and an Assistant Professor for the program here at University of Charleston.
We apologize that we were unable to do this live. We just had some scheduling conflicts, but we wanted to come and present to you guys today on how we are using a Simucase for classwork rather than just fieldwork opportunities. This is something that we've been doing, for the past year and a half, and have had a lot of success in meeting certain course objectives. And we're happy to share with you guys on how we are using it. So with that being said, we're going to go ahead and pull up Simucase itself, and Professor Turley is going to take it away for you guys.
Okay, he's pulling up our Simucase. There we go. In my classes, I use the videos. I do not use the simulations. I strictly use the videos. Cody will talk about using the simulations here in a moment. I'm going to pull up videos, and Frank is the patient. Oops. That I want to start with. Yes, laundry sorting task. Okay. And then we watch.
To your bedroom to get your laundry, and you're going to load it up however you typically.
Okay. So this video, I use this in the Principles of Performance class, where I teach steps to activity analysis. I use the videos to supplement the lecture and tie into the activity analysis process, identifying the type of analysis that we're going to be doing, the different body structures, looking at social and environmental aspects of the activity that we're analyzing. For example, in a recent class, the students had a homework assignment where they had to write an activity analysis of a clothes sorting task. So the next day in class, we reviewed those, but then I used Frank here. I'm going to mute Frank while this is playing, and I would use this to help the students identify what part of these tasks are important. I would have them identify, look at Frank's posture, give me some feedback about Frank's posture, the space demands of these tasks that he's completing. What are some of the safety concerns that you have? So what I do is I play the video with the sound on. I play the full length of the video. This one's not very long. They're usually not very long, but I'll play the full length video. Then I'll stop and I'll replay it again without the sound. And I'll pause and I'll ask the students the questions. They'll be able to, they ask questions, and then I ask them questions specifically about what activity and are we going to analyze. Do you notice how he is not relying on anything? He has the rollator, so he's not balancing on anything else. He's picking up that laundry basket. Just some very basic ideas and concepts that they may not have thought about before, but tie very well into our activity analysis. In my methods and modalities class, we used Frank as well. In that class, we teach treatment methods, we look at standardized assessments, and we introduce safety procedures that need to be reviewed. We had just done standardized assessments, and the week before, and fortunately with Frank, one of the assessments that we used was the timed up and go. I introduced the time up and go along with the TULIA for apraxia, the mini mental exam, and the Purdue pegboard. We practiced on each other in the class, but whenever I could show them Frank doing the timed up and go, the class just really lit up.
All right, Frank, are you ready for a little bit more? Ready. All right, I'm going to tell you what we're going to do with this test.
They really lit up and had a lot of questions that didn't necessarily come up with during the session that we were during the course time. Most of these students have had very little experience or observations at this point with any real clients, and really have not had an opportunity to ask questions about disorders in a safe environment. They may have noticed things, but they didn't have an opportunity to discuss conditions in a safe environment. So this allows us the opportunity to watch Frank doing that assessment, but also we can stop and pause and look at his posture when he's completing. We can notice how he rose. We can look at his gait. You can see here he has a little bit of that Parkinson's shuffle there with difficulty turning around. That raises a lot of questions for students, and this gives them an opportunity to ask questions and actually see a real patient completing the assessment. I also use this Simucase in my pediatrics course to help identify various disorders, where we look at typical development versus atypical development, identifying signs and symptoms of potential disorders. We also look at treatment interventions. There are several videos that have assessments and go from assessment into intervention. The Peabody motor scales is one example for pediatrics, and you can watch the OT performing the Peabody with several different children, different aspects of it, different parts of the scales. And then you can also see those same students doing, those same children participating in intervention. I also use the videos with a concept, with another platform. We have worked some of the Simucase case studies into an electronic health record platform. This allows us to practice documentation and practice reading medical records. I have provided evaluations on the electronic health record platform, and then related those evaluations back to, they tie back to the videos in Simucase. And it's a good way of the students to learn how to read documentation and follow the assessments for review of those cases.
One thing I wanted to note too is that us using Simucase this way, it kind of branched from, COVID and the pandemic, where students have not been able to, get the in-clinic experiences and stuff that we traditionally like to think of doing. I like Simucase because I feel like it is an all-encompassing kind of glue to our program. We can sit and practice this stuff in the lab, practice the assessments, practice making interventions and with patients all day, but it's still us. And I just think that there is something different about showing them a real life patient working with a real life practitioner and being able to break down those kind of things. I use Simucase in a different way than Professor Turley does. We have different course objectives. We teach different courses. I use mine, what's called OTA 204, which is our adult dysfunctions course. And I'm going to go ahead and stick with Frank to show you, she uses the videos. I actually use the simulations in class instead of the videos. So let me bring Frank up here really quick. The majority of my time with Simucase is spent in class doing intervention stuff. So that's the one I'm going to pull up here. So they have an assessment for Frank, they have videos for Frank, and they have an intervention portion for Frank. And they have different modes that you can go through. I always go through the learning mode with students. So what this does is I'll bring it up, I'll introduce to them who Frank is, why we are seeing Frank. And I'll do a little bit of an overview of the patient. This kind of gets them used to kind of like a miniature case study. So they can start kind of brainstorming ideas of what they're going to do with Frank. Some of the baseline stuff you can go
Hi,
through.
my name is Frank. I'm 80 years old. I feel like I've lived a full 80 years. I'm living at senior independent living facility. I've been here for about a year and a half.
Okay, so you can see as soon as you go into the patient, he automatically starts giving an introduction to himself, who he is, where he's living, the situations that he's having. Some even go even more into detail. You can go through and click and do, what is important to Frank. He'll tell you he's unable to put on his shirt. He's unable to do, certain things. And this kind of helps students issues. Again, I feel like it's a glue that brings everything together. So starting off, I'll bring up the Simucase in class, so get this introduction and get this rolling. What I do then is I kind of move through the occupational therapy process. After they find out who he is, the situation that he's in, all the demographic information. Then we go through and we write goals together. Because we believe in this program, it's real important that OTAs know how goals work, how to write goals, because I feel like that brings it all into light. It's kind of like the light comes on and they see the whole process. So we'll write goals together, and then we're going to go into the lab after we've worked with Simucase and seen Frank, all this stuff, and I will have them come up with independent treatment interventions. I'll often go into the treatment portion of this, and it will show different treatments that somebody had done with Frank, with this practitioner. And it'll let them see some common interventions and get their ideas rolling. And then what I do is I will tell them, come up with a treatment intervention that you did not see in this Simucase. And then I'll pick a few students out and say, okay, let's perform your treatment intervention. What'd you come up with? And then, then I'll play Frank and we'll go through that. But it brings it so it puts all the pieces together for them. The success and the creativity that I've seen out of students, and how far ahead they are on clinical reasoning skills. At this point in the semester, they're only through, halfway through their first fall semester in the OTA program. They're already coming up with independent treatment intervention ideas because they're actually seeing somebody with a real problem and they have ideas how to help them. And I think that's such an important process, to build OT clinicians. That's what we're all about, finding out what is important to them and helping come up with treatment interventions to help them overcome their issues. Some of the course objectives that we have in OTA 204 is the students will begin to understand the connection between client diagnosis and treatment interventions. That's huge because Simucase has such a wide variety in their library of different treatments or different diagnoses for different age groups and different patients. And then they can see common treatment interventions for those and then come up with their own outside of it. It's like an all-encompassing patient. It's like taking the student from the classroom and putting them into a clinic. This is as close as we can possibly get without physically taking them to a clinic, which has come in very handy, especially during the times that we're living in. You know, another course objective is for the students to understand how we turn from didactic work in the classroom into clinical reasoning skills and into clinical work for in preparations for field work. I do use Simucase for level 1 field works too. But this kind of gets them used to not only the platform, but these brainstorming ideas, because what they have them do on field work is extremely similar to what they have them do in the classroom when we practice those days. It's kind of shaped how we're doing our syllabi now and planning our schedules out, having treatment intervention days, whole days set aside of going through a Simucase and working with a patient just as you would in the clinic. So we use a Simucase in a little bit different ways. It is similar but different in a lot of the ways. So, with that being said, I really appreciate your time today. Professor Turley, is there anything else that you'd like to add on how you're using Simucase?
I can't think of anything off the top of my head. I know that we just get a lot of positive feedback from our students regarding the use of Simucase and how this really makes them feel like it's the light bulb moments. It's those light bulb moments that we all want to see. We do get to see that when doing this. They just light up, and you can tell that they are putting the pieces together, because first semester of the fall, and we're giving them all of these different classes, but then whenever they see the patient and we give them the opportunity to discuss and see these patients and discuss the various aspects of what's going on with them socially, physically, what their environment is like, they start putting it together. And that's a great starting point for clinical reasoning skills. And I've been very pleased with the outcomes with us using this.
Yeah. Traditionally, you'd ask students as they go into level 2 fieldworks, how nervous are they? And comparing, in years past with students who have done traditional level 1s of just kind of going in and seeing, the process in a clinic compared to students that did a Simucase, I almost feel like Simucase is giving a better experience, because traditional level 1s, you're just getting kind of to watch and following around. With this, they really get to come up with treatment interventions of their own. They're not just kind of following around and watching it. They get to see it, and they get to do kind of a hands-on simulation kind of work too. So again, we both want to apologize that we were unable to do this live for you guys. But we understand that you may have some questions for us on certain objectives you might have in your program. We're more than happy to talk to you guys about those kind of things and how we feel like Simucase can help. I wanted to note too, Simucase is made with a team of therapists, which is amazing. They really know they're OT practitioners that are helping build these cases and showing, real examples. So they have a very, very, very helpful team to help you show how to use Simucase, how you can incorporate it into your program. But if you have questions for us, we want to leave our contact information. Mine is Cody Dendler at ucwv.edu. That is COTYDENNLER at ucwv.edu.
Mine is Tracy Turley at ucwv.edu. TRACITURLEY at ucwv.edu.
So we appreciate your time today, and we look forward, to seeing you guys in the future at some conferences and whatnot. But, have a great day. Reach out to us with any questions you may have.
Thank you.
Thanks.